Imagine a patient with severe head injury. The brain starts swelling. Pressure inside the skull increases, and within minutes, the brain can be permanently damaged. But doctors have a powerful weapon to save the brain, a drug that literally pulls water out of the brain. Hello viewers, myself Dr. Mukib presenting you with another video on Mannitol, the drug that saves the brain in minutes. Watch till the end for complete understanding. What is Mannitol? So Mannitol is an osmotic diuretic, means it brings out water from the tissue by a process known as osmosis, which is commonly used in emergency medicine and intensive care. Mannitol is a type of sugar alcohol that cannot easily cross the blood-brain barrier, and because of this property, it creates an osmotic gradient that pulls fluid out of the brain tissue into the bloodstream, and the result will be reduced brain swelling, reduced intracranial pressure that leads to improved cerebral blood flow. Let's understand how Mannitol works. That means the pathophysiology of Mannitol. So inside our skull, there are only three components. One is brain tissue, and the one is blood, and the third one is cerebrospinal fluid or CSF. So when swelling occurs, pressure inside the skull rises. This is called intracranial hypertension or raised intracranial pressure. So high pressure can compress brain tissue and cut off oxygen supply. Mannitol works in two main ways. One is osmotic effect and the one is diuretic effect. So in osmotic effect, it draws water from the brain cells into the blood vessels by a process known as osmosis. And in diuretic effects, it increases urine production, removing excess fluid from the body. This rapidly reduces pressure inside the skull. So when do doctors use Mannitol? Mannitol is commonly used in serious neurological emergencies like severe traumatic brain injury, cerebral edema, intracranial hemorrhage, brain tumors, stroke, and some cases of acute glaucoma. In ICU settings, this drug can literally prevent brain herniation and save lives. Let's talk about the dose and administration of Mannitol. So in adults, the usual dose is 0.25 gram to 1 gram per kg IV. So in a Mannitol of 10%, means in a 10% Mannitol, it contains 10 gram of Mannitol. So it is given as an intravenous infusion over 20 to 30 minutes. So after infusion, doctors closely monitor serum osmolality, kidney function, urine output, and electrolytes. Let's talk about the side effect of Mannitol. Although Mannitol is a life-saving drug, it must be used carefully. Possible complications include like dehydration, kidney injury, electrolyte imbalance, hypotension, and rebound intracranial pressure. That is why it is usually given in hospital or ICU settings under strict monitoring. So the next time you hear about a drug that can reduce brain swelling within minutes, remember this name, Mannitol. A simple molecule, but in emergency medicine, it can mean the difference between life and death. If you enjoy learning real-life emergency medicine, subscribe to the channel because here I explain how doctors save lives inside the ICU. Follow me for more clinical updates and don't forget to subscribe and click the bell icon for notifications on new video. And comment below the alternative drug that can be used in place of Mannitol. Thank you.